The whole world awaits me, holding my breath, reaching up to take me, holding my breath. The whole world awaits me, holding my breath, reaching up to take me.
Hello, everyone, and welcome back to the third Asia-Pacific Clean Air Partnership APCAP Joint Forum. My name is Antoinette Toss, Goodwill Ambassador for the United Nations Environment Program. Grateful to be your host and moderator for this session, Clean Air for All, Strengthening Women and Children's Engagement. We would graciously like to recognize our partners, UNEP Empower Project, UNICEF East Asia Pacific Regional Office of the United Nations High Commissioner for Human Rights, and Vital Strategies, who help make this session possible. Clean air is a basic human right, but more and more people today are being exposed to unhealthy levels of pollution. Air pollution affects everyone, but the people at most risk are women, children, ethnic minorities, and persons with disabilities. In low and middle income countries, household air pollution is a main cause of non-communicable diseases. An estimated 1 billion children globally are exposed to exceedingly high levels of air pollution. Young children are especially vulnerable as the negative effects of air pollution on a child begins at the time of conception, continues during childhood, and can even affect their overall development. During air pollution episodes, many schools had to be closed in the most affected areas, depriving learning opportunities from children. This is unacceptable. Everyone has a right to a healthy environment and to breathe clean air. However, we need solutions to address challenges posed by air pollution. These solutions should support a human rights-based approach and successfully consider gender perspective and child-centered approach. This is what we will explore today. Let's first start with an introduction of what these solutions are. Our colleagues from UNICEF and UNEP will provide an introduction of child-centered clean air solutions in Asia and the Pacific region. I would like to invite Ms. Sunmi Choi, Climate and Environment Advisor from UNICEF East Asia Pacific, to introduce 20 child-centered clean air solutions. Colleagues, as this is a virtual event, we highly encourage you to send in your questions in the chat function as well. Sunmi, over to you.
Great. Thank you, Antoinette. Good morning, good afternoon, distinguished panelists and partners of the Asia Pacific Clean Air Partnership. It is a great pleasure to join you all in this very special session focusing on children and women. Can I make sure that the slides are ready? If you could just indicate to me, because I cannot see the slide. Great, I see it. Thank you very much. So in August this year, just a few weeks ago, United Nations Children's Fund, UNICEF, has launched the Children's Climate Risk Index. If we could show on the next slide, this Children's Climate Risk Index that was launched globally just a few weeks ago, it shows that globally 1 billion children, nearly half of the world's children, live in extremely high-risk countries. The climate risk, including air pollution, is already having a devastating impact on the well-being of children globally. Climate crisis is creating a child rights crisis. It's creating a health crisis. It's creating an education crisis for children. It's threatening children's very survival. In all these ways, it is infringing on every aspect of children's rights, as enshrined in the United Nations Convention on the rights of the child. Next slide, please. On the next slide, as you can see, children are confronted with multiple climate, environmental threats, and air pollution is one of key risks to children. As indicated in this image, air pollution exceeds safe levels for nearly 2 billion children in the world. It is exceedingly high for over 1 billion children, where we see even a 15% higher chance of death. This condition is likely to get worse under the current business as usual. As you can see in the next slide, please. In the next slide here, COVID-19 actually has added a new dimension to this challenge. We need to tackle air pollution in the context of compounded crisis of climate change and the COVID-19 pandemic. We estimate that 150 million additional children are living in multidimensional poverty, losing access to essential services like education, healthcare, reversing many of the gains we have made on child health, education, nutrition, and poverty. But as you can see in the next slide, please, the recovery process is also an opportunity for us to reimagine a world better fit for children. We must seize the opportunity of COVID recovery to transition towards a low-carbon, climate-resilient, and inclusive society. However, the reality of where we are, especially in our region, is quite alarming. Only 21% of COVID-19 recovery spending by largest economies is considered to be green. Current recovery measures, as we see it, are more brown than green. Asia Pacific accounts for almost 94% of the global pipeline of coal-fired power plants, spending $100 billion more on fossil fuel subsidies than on renewable energy investment, threatening to lock in high emissions as well as air pollution, thereby threatening the very survival and well-being of our children and future generations. Clean air policies and investments must be at the core of climate and COVID-19 recovery measures, and clean air measures must deliver immediate and long-term benefits for children and women. Next slide, please. In this context, I'm very pleased to share our 20 child-centered solutions guide with all of you here on behalf of UNICEF East Asia Pacific Office, UN Environment Programs Asia Pacific Office, and also our technical partner, Asian Institute of Technology. As you can see in the next slide, please. The 20 child-centered clean air solutions are proposed to address unique vulnerabilities and exposure of children to air pollution. As indicated in this image, air pollution has a multitude of effects on child health over their life cycle, from prenatal, childhood, to adolescence and adulthood. The effects of air pollution on children are critical and complex, ranging from respiratory health, cognitive functions, cardiovascular diseases. In addition to these health effects, the cumulative effects of air pollution can cause social and economic deprivation, increasing risk of poverty, inequality. Next slide, please. Through our partnership with UNEP, UN Environment Program, and AIT, Asian Institute of Technology, we have ensured these child-centered clean air solutions are based on best available science. The first starting point was from the science-based solutions identified through global and regional scientists and air pollution experts, including conventional air quality measures, also next stage air quality measures, and those that can deliver co-benefits to development priorities of the region. These 20 child-centered clean air solutions were identified in terms of its air pollution emissions from target sources and their contribution to air pollution levels in child-centric locations. Child-centric locations, thereby we mean where children spend most time. We have grouped the clean air solutions by when, where, and children can play, learn, and live. As you can see in the next slide, please. These 5 measures, first of all, under the grouping of when, and where children travel, these 5 measures are proposed for immediately reducing children's exposure to air pollution during their commuting time, which include emission standards for light and heavy duty vehicles, volatile organic compound recovery from gasoline distribution, conducting emission checks and maintenance of school buses, and mainstreaming electric mobility, increasing low emission child-friendly areas such as pollution-free clean air zones for children around schools, playgrounds, and healthcare centers. And next slide, please. And under this grouping, this grouping is where children live. And the cleaner solutions we're proposing here are providing clean fuel and technologies for heating, cooking, and lighting to fight against indoor air pollution, enforcing bans on household waste burning, of course, supported with solid waste management services, safely managing household chemicals, and promoting child-friendly green urban planning. To address air pollution from open burning of biomass, which is also a critical transboundary air pollution issue in our region, we also must strengthen better management of agriculture crop residues and improve forest and peatland management, preventing forest and peatland fires, improving and enforcing industrial emissions regulations are also urgent for improving air quality in our region, especially in areas where children live, particularly those poorest and disadvantaged communities, often living in most polluted areas. Next slide, please. The final set of 5 solutions here are related to where children play and learn. And the solutions we're proposing under this category are clean cooking and fuel and technologies and street markets, school canteens, waste management in and around schools, controlling dust around construction sites near schools, and controlling emissions from small industry craft villages that are often seen in many of our developing countries in the region. The final solution is most importantly about empowering and engaging children and youth in clean air actions, providing them with a safe space to discuss and express their views and opinions on air pollution, and also with the best available science and information on air pollution sources, health effects, and solutions. We also need to increase our technical and financial support and participation platforms for children and youth to learn, identify, and implement youth-led cleaner solutions, such as participatory air quality monitoring, reducing and recycling waste, and increasing green space in urban areas. Final slide, please. As I conclude, while the latest science on climate change and the slow progress of climate actions is indeed very concerning, we must move forward and act together with a great sense of urgency, as we have demonstrated in our Child-Centered Clean Air Solutions Guide. Practical and cost-effective solutions are here for us to implement immediately and scale up. Our children and youth present us with the biggest hope in our fight against the climate and air pollution crisis. Please join our efforts in realizing the rights of every child to breathe clean air, survive, and thrive through child-centered clean air solutions. Thank you very much for your attention.
Thank you very much, Sunmi. Now that we have had an introduction on child-centered clean air solutions, let's explore how air pollution affects women, children, and other vulnerable groups. We have 3 esteemed guests joining us today for this conversation. Our first speaker is an air pollution epidemiologist with over 8 years of research experience focusing on air pollution, environmental health, and urban health. Please welcome from Vital Strategies, Dr. Vivian Pun. Our next speaker, good afternoon. Our next speaker has been working in the area of environment and development for the last 2 decades. He currently works with World Health Organization country office in India as a technical officer for environmental health. Thank you so much for joining us, Mr. Manjeet Singh Saluja.
Thank you.
Rounding up our panel is a passionate environmental activist from Palangkaraya, Central Kalimantan, Indonesia. He is a young teacher who has been involved in forest campaigns since 2017 in collaboration with local and national communities in Indonesia. Hello and welcome, Mr. Nathan Undas. Thank you so much for joining us today. We'd like to begin our conversation with a question to Vivian. Dr. Pan, we to begin with asking you exactly what the impact of air pollution is, not just to people's health in general, but also how does air pollution affect women and children as well?
It's my pleasure to speak at this panel, and thanks, Antoinette, for the introductions and questions. I hope everyone knows by now that over 90% of the world populations are exposed to unhealthy air. and that air pollution is the third leading risk factor for death, killing 7 million people worldwide each year. We learned from a large body of evidence that air pollution cause health problems, including stroke, heart disease, diabetes, lung cancer, as well as both chronic and acute respiratory diseases like asthma. Not only do air pollution affect our physical health, there may have been even greater impact on our emotional state and health, as there have been increasing evidence linking air pollution exposure to a range of mental health illnesses such as depression and anxiety. So the health impact and burden of air pollution is really something we cannot ignore. It is true that air pollution affects everyone, but children and women face increased risk from air pollution due to various factors, one of which is the traditional gender roles and cultural norms, which means that women and children tend to spend more time at home so that they're closer to the pollution sources such as household air pollution from using solid fuels and cooking and heating. Children also face unique risks from air pollution because their organs, their cardiovascular and respiratory system are still developing. So they breathe in generally 2 to 3 times more air and at a much faster rate than adults. So it is really no surprise that air pollution is the second leading risk factor for death in children under 5 years old, killing nearly 700,000 children each year, more than from unsafe drinking water and poor sanitation combined. As the introductions mentioned earlier, when the pregnant women are exposed to air pollution, that's where the health damage begins, resulting in adverse birth outcomes such as preterm birth and baby born with low birth weight. It is also well known that air pollution exposure during childhood also linked to higher risk of child pneumonia and other respiratory diseases. And these early life outcomes have long-term consequences on health, leading to increased risk of non-communicable diseases throughout the child's life. Another kind of lesser acknowledged, health outcome associated with air pollution is stunting. And the reason why I mentioned stunting is because stunting is one of the most well-established indicators for poor child development. Not only do stunted children experience diminished health, height, and physical development, they often suffered from impaired cognitive and social-emotional development and higher risk of illnesses and early death. Even though the most direct risk factor of stunting are malnutrition, poor diet, and sanitation among mothers and children. We at Vital Strategies found that results from studies from 29 countries published over the past 2 decades significantly reinforced the linkage between air pollution and the increased risk of child stunting. The risk began in the womb as the mother kind of inhaled the defined particulate matter, the pollutants that are most dangerous to health, and the risk continues throughout the childhood. One of the studies mentioned found that the children who were exposed to air pollution in Europe during the 1997 Indonesian forest fires were on average 3.4 centimeters shorter at age 17 compared to their peers who were not exposed. Scientists are still determining the exact kind of biological mechanisms connecting air pollution and stunting. But it has been commonly hypothesized that the prenatal and postnatal exposure to air pollution may increase oxidative stress, which means it can have damage to the cell and DNA and induce acute placental and pulmonary inflammation and coagulation, thereby restricting the growth of the fetus. So our results and also many kind of findings on kind of adverse birth outcomes are really relevant to low to middle income countries, especially in India and Indonesia, where the air pollution level and the number of stunted children are among the highest. To kind of put it in a perspective, in India, for example, a country with the highest burden of stunting, with 36 million or 32% of the children there under 5 are stunted, reducing air pollution levels to meet the country's national ambient air quality standard could result in 3 million fewer babies born with stunting-related outcomes. So it is really important for clean air policies to be equitable and consider who are the most vulnerable and likely to be affected by air pollution, such as children living in highly polluted area and families who use solid fuels for cooking and heating, for example. And lastly, on the same token, we should also consider investing in clean air to be integrated into health promotion strategies to really improve the health of children and other vulnerable populations.
Thank you so much, Dr. Pan. I'd like to follow that up with a question that actually, from the way we're having this conversation, it really seems that it's more than just the public that needs to be made aware, but it also seems like we need to zero in on the individuals that are most affected as well, women and children and households. How do you think we can both raise the public's awareness on the impact of air pollution so that we can collectively move forward on a better pathway, but at the same time, also really get this information to women and children and into households so that they also know the right steps to take so that they can better protect their health and reduce air pollution at the same time?
So this is a very good question and an important one because we really need public awareness and also the people who are suffered the most, impacted most, to kind of raise their voice to drive political will for action. Unfortunately, oftentimes the conversation around air pollution is seasonal, such as during haze season, haze episodes when a city is covered by a thick blanket of pollution, then when you can see it. So we really need strategy and media campaigns to the public and also to the kind of vulnerable populations, targeting them to really maintain kind of the public engagement on this topic year round, especially during the off-peak air pollution season. For example, people now are more increasingly talking about climate change. So we really need to raise the awareness of the shared costs and solutions for both climate change and air pollution. This year, the United Nations Climate Change Conference COP26 will be a good opportunity to really emphasize how we can use policy design for mitigating climate change and air pollution to include indicators for air quality and health, and especially health for those vulnerable populations. Another point I want to raise is that what we found from several of our audience perception study is that there is often a real disconnect between the reality and the fact of air pollution and the public and media discourse. People often focus on the wrong pollution sources. That's why the policy solutions are often not effectively targeted. So it is also very important for us to raise better awareness on the leading source of air pollution, and also with the new evidence from children's health, the lasting impact of air pollution on those vulnerable populations, using the proven and credible air pollution data and studies to correct those misconceptions. The last point I would like to highlight is that we really need to communicate to the public the values of collective actions for long-term solutions, and really recognizing the limit capacities of individual actions to influence air quality. Policy change is the most effective way to improve air quality, and public awareness, and most importantly, public demand for clean air is really the driving force for political will to take action.
Thank you very much, Dr. Vivian Pan, and for stressing that once again. I feel like all the big moves that we need to make, we always say that at the end of it all, as we move collectively, we use our voices to urge policy change so that we can see sustainable change for the future. Dr. Vivian Pan, thank you very, very much. Now we'd like to invite our colleague from the World Health Organization, Manjeet, Mr. Manjeet Singh Saluja. Manjeet, we'd like to ask you a few questions, beginning with what you think the impact of air pollution is in India and how it has specifically affected women and children there. I know that Dr. Pan actually just mentioned the situation as well and how dire and urgent this really is. Could you tell us more about this, Manjeet?
Sure, and let me start with a very good morning and good afternoon for colleagues who have logged in from all around the world. And thank you to the organizers for having me here, and thanks to you for kind of putting this very, very pertinent question for this panel discussion. So I think Vivian has really set the context from the India and Indonesia point of view. So I'll not maybe kind of stress on those points, but just me kind of let me start with saying that yes, air pollution has been one of the most pressing problems of India in recent years, and this polluted air or toxic air is not only a massive health and environmental concern, but also takes a huge economic toll. It impedes development and affects also kind of people's welfare. So on the health side, yes, there is a huge body of evidence from various set of kind of stakeholders. It's not only one. On one side, we have many international reports almost kind of every year focusing on India, whether we kind of talk about the Health Effects Institute, whether we talk about my own organization, WHO's Global Burden of Disease data, the IHMI data, the number, and they all are kind of saying a similar thing, and the numbers kind of now are more or less similar in terms of the health impacts of air pollution, because the international methodologies have kind of got harmonized, and also the second part is that more and more kind of pollution is being measured across the country. India has seen investments in monitoring air quality, especially if I say during the period of 2016 to 18. This helped increase the availability of the ground level particulate matter 2.5 data, which is a kind of a particulate matter of concern for health concern mainly. And this has also significantly decreased the uncertainty in the global exposure models when they are being kind of applied to India, and therefore we are getting more reliable estimates. So which means that yes, from the international side, there is harmonization, and there are similar numbers coming from various set of stakeholders for India, that yes, it affects in a major way. But then going kind of in-house in the country, if we look at the government's own assessments, and out of which the most notable I would kind of let me mention one out here is the ICMR, the Indian Council of Medical Research, which is the research body of the Ministry of Health and Family Welfare. So ICMR's India's nation health of the nation state report, which was kind of released in November 2017, that identified air pollution as the second leading risk factor for diseases and injuries that could lead to premature death and disability in the country. So that's how kind of even the government is kind of recognizing and the problem, and has kind of shared evidence on this. And then it's also not only on the scientific studies, but even the response from the medical bodies and even the regulator itself. So a couple of years back, during this episodic air pollution in November, the Indian Medical Association had declared an emergency, a public health emergency. And very lately in 2019, before the global pandemic had set in, the Central Pollution Control Board in India, which is an autonomous body under the Ministry of Environment, they declared a public health emergency in the afternoon of November 1st, 2019, because when the air quality kind of plunged to severe plus levels since the night of the October 31st. So that's, it's not only the evidence showing, but then yes, there is a problem and there is recognition of it, which is also being shown by these actions. So that's on the ambient side of it. And since your question is focused on especially the women and children, and again talking about the major sources, household energy becomes a major source. And we are already kind of Vivian has kind of shared that when pregnant women are exposed to polluted air, they are more likely to kind of give birth prematurely and kind of have small or low birth weight children. Air pollution also kind of impacts the neurodevelopment and the cognitive ability, and it can kind of certainly trigger asthma and the childhood cancers. Children also have been exposed to high levels of air pollution, maybe at greater risk for kind of chronic diseases such as cardiovascular later in their lives. And air pollution not only kind of damages the lungs, and it also kind of, even at the low level of exposure, it kind of has it damages the children's lung function, can certainly lead to stunted growth of the lungs in the children. And to kind of share some evidence, kind of broad evidence points out here, especially for India, and there have been big cohort studies in India. Like for example, notably, I would like to mention the Tamil Nadu Air Pollution and Health Effects study, which kind of aimed to examine the association between the particulate matter exposure kind of select maternal, child, and adult kind of health outcomes. And they had shared that it's associated with, they estimated around an 82-gram reduction in birth weight with the indoor air pollution. So 82 gram, and India again is having a problem of low birth weight children. Then I think what Vivin mentioned about on the impact of the childhood stunting, and again there was a study which was carried out on around 200,000 children all across the districts of India, which were surveyed in the National Family Health Survey a few years back. And it was kind of certain that for a 5-year-old girl, it translated to around 0.24 centimeter loss in terms of the height. And that's kind of again, when the country is facing a huge issue of stunting, I think this becomes a major figure. In terms of association of, again, the particulate matter with child anemia, India again in that particular term has one of the highest anemia prevalence in the world. And and this particular study shared that for every 10 microgram increase in the particulate matter, the anemia prevalence increases by 1.62%, and the hemoglobin kind of decreases by 0.077. So that's again a kind of a significant association of particulate matter with child anemia. And let me kind of mention, all these studies are localized studies which have been done by organizations of repute within the country and kind of have been carried out by the Indian stakeholders. Then again, on particulate matter and child mortality, again, air pollution is considered to be the second largest risk factor in the neonatal mortality in India. So it's kind of the Indian studies, some of these are mentioned out here. They have also contributed either directly to the global burden of disease data, which is kind of our related exposure models, or kind of provided evidence for kind of consistency in estimates. So there are many studies that are presently either running or have been kind of completed, and I will not go now in more details. But certainly some of them needs, the notable ones needs mentioned is the household air pollution intervention network, the HAPPEN trials, or which is a multi-country randomized control trial on LPG, the Delhi air pollution health and effects kind of the Daphne study, which is going on. So there is a large body of kind of evidence which is already there and is kind of presently also going on as well. So we should certainly invest in exploring even new frontiers, like maybe the issue of toxicity and even the long-term cohort studies to strengthen more India-specific burden estimates, as it is always kind of necessary to have reliable estimates of exposure to the health impacts from air pollutants. They become certainly key to inform decision-making on policies and programs in different sectors. But actions do not need to wait for the last decimal place of evidence. We already have a large body of evidence. India recognizes that problem. And therefore, we have also seen there are very many interventions which have taken in the past couple of years. Maybe for actions to be certainly successful and to be pinpointed to that, we need reliable estimates. And not only reliable estimates, we also need stakeholders to start talking to each other and to be in constant communication. Because as I think from the point where you started, air pollution affects everybody. So therefore, it cannot be kind of solved in silos. It is everybody's business, and therefore all the stakeholders need to come together, and there is a sufficient body of evidence. I'll stop here and maybe if you have a follow-up question on this. Over to you.
So much, Manjeet. I actually wanted to ask you that with policy change in mind, and I know that you had mentioned a number of things, the items that I had asked Dr. Pun earlier, like how it specifically affects women and children. Thank you so much for adding more to that. But specifically talking about policy change already being in place and keeping that in mind, and at the same time bringing stakeholders together. Can you give us concrete examples from your experience as well, how we can better protect women, children, and other vulnerable groups as well?
Okay, before I kind of come to this, I would kind of just maybe notably mention a few of the policy kind of initiatives in the country. And as I said, that there is a problem India has certainly kind of recognized this problem, and they've also taken steps. And some of the kind of the notable ones which I would like to mention out here is certainly we have the Ministry of Environment, Forest and Climate Change is kind of implementing the National Clean Air Program with a goal of achieving somewhere around 20 to 30% reduction in the particulate matter by the year 2024. And yesterday itself, because of this, on the occasion of this International Clean Air Day for Blue Skies, the minister, the Honorable Minister for Environment, has kind of launched a portal called as Prana, which is a portal for regulation of air pollution in non-attainment cities. So India has around more than 100 non-attainment cities. So this particular portal will certainly regulate the activities and kind of monitor the activities of air pollution in these non-attainment, and will monitor the implementation of the National Clean Air Program. So that's where a big set of intervention with this National Clean Air Program, which is a multi-sectoral program where it kind of brings together all the line ministries on for the actions. So that is one. We have already heard kind of announcements from the highest level. Honorable Prime Minister Mr. Modi had raised India's ambition by expanding the country's renewable energy target from 175 gigawatts to 450 gigawatts by 2030. And we also see India's efforts in terms of the renewable energy, where along with France, India is a founding member of the International Solar Alliance, which was launched in COP21 in Paris and brought kind of 98 countries together to endorse the clean energy, sustainable environment, public transport, and kind of climate action. And again, kind of recognizing the whole need for clean energy, and especially as I kind of specifically mentioned in the previous question on the household energy aspect. India had embarked on a journey for kind of providing the clean cooking fuel through a scheme called as the Pradhan Mantri Ujjwala Yojana, which is the LPG scheme, where they provided free LPG connections to more than 80 million poor families to replace the polluting biomass fuels. And this has helped improve the access of clean fuels in kind of many large states of India. And we have already seen some of the large surveys which are conducted. For example, I mentioned NFHS, which is the National Family Health Survey, which is conducted after every few years. There is the latest set of data which is coming in of NHFS 5 for few states. We have seen a big jump happening in the access to clean energy to the kind of rural women, and so that's kind of a notable achievement. And again, India is also working on some of the most comprehensive electric mobility policies to reduce pollution from the vehicles, and that's more on the central side. But also there are various actions, and the cities are making progress, and kind of there's leadership being demonstrated by cities, various cities across India, whether it's kind of the Ahmedabad or the western side, Pune, Surat, Bangalore, which is the south city, to drive city level action to improve air quality. Cities also committing to the Breathe Life kind of the Breathe Life network, which is a global campaign of a joint campaign of the World Health Organization, United Nations Environment Program, Climate and Clean Air Coalition, and the World Bank. So in late 2019 and early 2020, around 4 to 5 Indian cities have committed to join the Breathe Life network, and they've committed kind of to work on air pollution issues. So we see there's a kind of a lot of multi-sectoral efforts which have happened in this particular area. But again, coming back to I think your question on what we can kind of do more, and so certainly, as I think even previously what Vivian mentioned, in terms of the awareness and behavior change, there's a necessity to create a demand from the public on air pollution, and kind of so what we can do is certainly kind of conduct large scale information, education and communication campaigns, to which kind of have to drive the health messaging around the big schemes, whether it's the Ujjwala Yojana or whether kind of the other, but the health messaging around those schemes that air pollution kind of affects the health needs to be kind of built into it. And while we kind of encourage the various stakeholders, kind of even including the health system, or maybe kind of going down to even to the village level and communicate these activities. And also that, so that is one part on the population and on the communities. but also within, if I talk from the medical community point of view, there needs to be improvement on the awareness levels within the health systems as well, and even the medical professionals on the health impacts of the ambient as well as the household air pollution, because again, the medical community is people lay their trust upon it, and I think they need to kind of share this message of air pollution and the health impacts a little more kind of strongly, and for which they need to be kind of aware of it. And again, I think the second point which I would like to mention, and maybe I'll stop there, is India is a large country. We are aware with the kind of the size and the diversity of the country. We cannot have a one size fit all solution. We have certainly recognizing India's efforts towards doing large programs, for example, providing clean LPG cylinders to 80 million rural households. But then one size will not fit all. So, and there could be kind of supply chain challenges. So it's necessary to kind of promulgate customized and kind of context sensitive solution for clean cooking, while utilizing even the innovative approaches for financing and maintenance. So we can kind of certainly talk about making the available clean. We kind of provide them wherever we cannot provide LPG, we kind of make them clean biomass stoves. Wherever we can provide LPG, let's kind of provide them LPG. Wherever we can provide induction stoves, so making the clean available. So let them kind of give them options of the clean energy, kind of where this is an option and where the supply chain can. And then also taking it at the community level also, where we can have where we have examples of maybe smokeless villages, where all the people are kind of have shifted to such initiatives. So maybe the whole concept of smokeless villages could be kind of more promulgated in the country, and certainly kind of examining the innovative service delivery mechanisms to address the distribution challenges in the rural areas. For example, maybe we can talk about consumer financing, because again, the purchasing power parity becomes a major issue, or maybe the cylinder size, reducing it so that again it becomes affordable. I think such context specific solutions need to be kind of brought into the country to make it to make the uptake far and wide, and also to kind of sustain those efforts, because otherwise a person would buy a cylinder and then again would switch back to the biomass fuel. So that's where this kind of in terms of sustainability it helps. I'll stop there if there's any follow-up question from your side. Over to you.
So much, Manjeet. Actually, just really quickly, you mentioned so much valuable information, from platforms to specific solutions and pathways forward. We would just like to ask if there are any tools or guidance available that can be accessed, that people can use to help understand and assess the impacts of air pollution on vulnerable groups, that people can actually access as well, so that it can guide them forward.
Yes, in terms of the guidance and the tools, yes, I think I would just quickly mention maybe another 3 to 4 minutes. There is a kind of pioneering effort in India in the health sector. The Ministry of Health has kind of initiated a national program on climate change and human health. So what we are kind of advocating of health in all policy, or maybe the health sector to drive that particular air pollution agenda. I think that's where there is an effort in India which kind of needs a mention, where and how kind of we are supporting that is we are kind of trying to support the government in developing solutions and certainly building the health sector capacity towards it, so that there's more demand coming in terms of developing advisories to communicate the health impacts of air pollution to the general public and to even the medical community as well, and strengthening the data and the surveillance aspects as well. So efforts how to kind of integrate the air quality data with the hospitals data, with the outpatient department data. So those are kind of important points with it. And then in terms of what we have just again done day before is we have released the whole in our efforts towards capacity development. We have released training modules for vulnerable populations. We have released a set of 4 modules with the National Center for Disease Control under the Ministry of Environment and Health to sensitize and protect the vulnerable populations. And a vulnerable population, when we say, it is certainly the women and the children which are kind of exposed, but we also are looking at from the occupational point of view as well. For example, the traffic policemen who are standing at those busy traffic intersections and kind of are inhaling that high levels of particulate matter. And then the municipal workers who are again, because of the lack of knowledge, they are burning that particular trash and again inhaling those toxic fumes. So we have tried to we have released these training modules in very, very simple language, in the local language of Hindi and also kind of of other states, where we are trying to we will try to help them sensitize, and again we'll involve the health the frontline health staff, because again that comes with the trust that yes, the health will be affected, and they will help them sensitize these traffic policemen, these kind of the municipal workers, the rural women and the children on the effects of kind of air pollution. And with this whole this NPCCH kind of the national program going to the states and going to the frontline workers, this is what is it kind of helping us is to kind of develop the capacities and also for these officials to conduct a risk assessment. They can kind of help guide the local decision makers, what actions would be useful, what actions can kind of help bring some gain. And for those, WHO has kind of already a set of tools which are available to conduct these health risk assessments. And I can kind of mention maybe the names, like for example, the Air Quality Plus is there. There is kind of a tool on to evaluate the integrated sustainable transport, to evaluate the green spaces, and also to kind of evaluate on the effects of health and economy on the improvement of air quality. And also just kind of to mention out here one particular tool which has recently been kind of released out there is the benefits of actions to kind of reduce household air pollution, the BARHAP tool, which kind of is an important tool again, which could be kind of taken up by these local decision makers to help the local policymakers to kind of really act on which actions would be the most impactful and can kind of bring in positive impacts. So all these tools and guidelines and guidance which are available in the country and are being made available, and there are efforts to kind of take it to the last mile. So over from my side. Thank you so much for this.
Thank you so much, Mr. Manjeet Singh Saluja from the World Health Organization, Country Office in India. Thank you so much for the valuable insights and knowledge that you've shared with us today, and thank you for all that you do. Now from Manjeet, we move on to Nathan to hear about his personal experience, advocacy, and journey. Mr. Nathan Undas, would you like to share with us your personal experience and the story of how air pollution from open burning has affected your community?
Well, thank you, and good morning and good afternoon for everybody, every side of the world. Thank you for having me in this meeting. I so feel honored to be joining in this discussion. Well, in Central Kalimantan, where I live now, the capital is Palangkaraya. We've been lived together with this particular situation, which open burning, for decades. Ms. Vivian said it's some data from 1997, and it's true. We've been living for the open burning situations many years ago. And it is still fresh in my mind, my memories, that in 2007, we have our entire city covered by smoke. Even the vision, the sight was only less than 100 meters. I think I got a video. Is that still already played or not?
Yes.
I gave the video. Okay. Yes. That video, I took it in 2019, and every year the open burning causes the smoke is getting worse and getting worse. There are only, maybe from my side, 3 words that can describe how we felt: breathless, threatened, and breathless. Well, before this pandemic, we've been familiar with wearing masks, you know. Schools, office, or supermarket, everywhere, at least for 2 months, the smoke is outside. And it's just not outside, it is inside our house, close building, church, mosque maybe, and even in our bedroom. the smoke is there. It is very, very thick, and it is everywhere. If you don't have any air conditioner or air filter, you live with it at least for 2 or 3 months. It is likely a yearly activity for us. It started at least from July to September. Schools and university, they had to close at least for 1 until 2 weeks, and it could be longer. Service, it could be longer. We have the worst. The schools and university had to close until 1 month, and that's very sad to hear that. Children are very vulnerable. We need to protect them. And from the data in September 2019 showed that the PM10 score was more than 500, which means it is a super dangerous. It's poisonous. And hospital full of serious respiratory issue that was spatial. They made a spatial room for the patient that have symptoms like what is that? Difficult to breathe or something like that. The hospital was very crowded at that time. And the best way to avoid that is just to stay at home. We've been hearing this statement since many years ago. Stay at home or evacuate, leave the city as soon as possible. For those who don't have extra money, or for those that I live here, we are the indigenous people. We live here. We don't want to go outside of our city, of our village. We don't have any option. We just leave it, take it, and regret it. And our community from 2017, 18, 19, we've been busy for distributing masks for people that have to be outside, and it was really under control by the government. It is a frequent event. This happens most of the time, every year. But thank God, I think 2020 and 2021, we don't have any open burning fire. I believe that is because of the climate change or something. We have freaking rain, heavy rain, absolutely, at least this year and last year. And it helps us on the other side not to trigger any open burning. But we have another problem, which is flooded, because tree all cut down. And for us, it feels like a trap in a huge yellow balloon, breathless, can go anywhere, and wait until rains come in.
Oh my, thank you so much for sharing your story, Mr. Nathan Undas. The thing is, as we move forward together, given the challenges to reduce open burning, we'd like to ask you, from your perspective, what kind of support is needed, and how can Indigenous peoples and local communities engage with the effort to reduce air pollution, specifically from open burning?
Well, yeah. The most challenging thing is we could see the smoke, but we didn't know where it came from. Yes, it's sometimes it's in countryside, but we could find several small fire, and the firefighter they can overcome it quickly. But however, if we see from the data of this hotspot area, it was in a remote area, and it's peatland area. If you heard about peatland area, it's like a unique structure, soil structure. It's a type of wetland, rich of organic matter formed by accumulated decay of organic matter of 1,000 years. So it is very unique. Well, it is not supposed to be in dry condition. The peatland, there's supposed to be a tree and another plants grow on it. If we cut a tree, clean the peat area to make a farm field as well, in Central Kalimantan, we have so many palm oil industry, and they have almost, I think, half of our province in Central Kalimantan is changed into palm oil industry. And most of our land is consists of peatland, which is a very unique structure. And if it dry, the trees, the plants clear and cut, the peatland gonna be dry, and it's supposed not to be dry. Seriously, if it's dry, it turns into massive dry plant pile, like you like a dry leaves. You put them into together, and it's gonna be massive pile, and it is massive everywhere. And you know, long dry season from July to September, that usually happen, but the last 2 years we don't have it. It's gonna be a perfect match. And once there is a fire, which absolutely caused by human, it's gonna be a very huge fire. But the unique thing is the burning peatland is like a tricky thing, because it seems like has gone out on the surface, but in reality, the peatland, when it's burning, it goes down or horizontal and spread out without any fire visibility in the surface, but it's burned to the ground. And it takes days or even months to take them down. It is very hard. It's a hard challenge for us when there is a fire, but it's in the peatland territory or peatland area. It is you're going to see white smoke every day for days, for weeks, even for months. It is like untouchable. And most of the open burning, most of the fire is in a pit area. All we need is a commitment from government, enforcing the rules and laws for clearing lands, especially in peatlands. So no more peatlands change into a palm oil industry, or no more peatland massively change into something else. Let peatland be a peatland. It is there. It's been there for 1,000 years. Don't turn the peat area, because if it's dry and if it's mid the fire, it's going to be massive fire. We need the preventive action. Actually, my community and I, we've been doing a lot of advocacy, but it seems not really like work all the time. And we try to change our perspective. We try to change our how we get close to the younger people, to younger students. They should know that that this is a case. This is your future, and you need to get engaged with this. We make like a seminar, like even we make a music concert, a mini concert, just to tell them, hey, burning is everywhere. Wake up. This is our time. If we let this happen, air pollution is the first, and you're not going to see your forest anymore. It's gone. It's maybe just a story. And yeah, we really need the commitment from the government. But in 2020 and 2021, this month now, we have 4 regency is in flooded situation. We don't have any smoke anymore because the rain, but peatland, it says not only the burning area, but flooded. 4 regency now. If you can Google it, Indonesia or Central Kalimantan, it is flooded this height. And we are collecting as much as help to help the vulnerable people in the village, especially because they are untouchable. And the Dayak people, we have beliefs that forest is the source of life, the indigenous people of Central Kalimantan. We believe that we can live with the forest side by side, not to harm it, but live side by side, not to cut them down. And we exactly know there are some people that not responsibility for the massive fire, but we try to educate the locals try not to sell their land to maybe palm oil industry or something, because it happens in Central Kalimantan. Locals, they said, this is my land, you can buy it, and they take the money and it's completely disappeared. The peatland disappeared, and it triggered the massive burning, open burning fire. That's for me, Antoinette.
Thank you so much, Mr. Nathan Undas, for really sharing the importance, not just, of course, of policy action, as we've mentioned, but also sharing the information needed for everyone to be aligned with pathways forward. We are running out of time for this panel. We thank our guests for their informative insights and remind everyone again that everyone is affected and we all have the power to affect change. Now that we have a better understanding of the impacts of air pollution, we would like to hear some inspiring stories from our esteemed panelists on innovative and readily available solutions which we can take into our homes and communities to help beat air pollution for healthy air and healthy planet. Before we introduce them, let's watch this video on how empower women for clean energy and clean air. We have an esteemed panel joining us today to share and discuss clean air solutions for and by children, women, and vulnerable groups. Our first guest is a member of Parliament of Mongolia and Deputy Chairman of Mongolian People's Party Caucus of the Parliament. She chairs the Subcommittee on Sustainable Development Goals, and before being elected as a member of Parliament, our guest worked as the Vice Minister of Finance of Mongolia. I am pleased and honored to welcome Ms. Bulgantuya Kulbatar.
Thank you very much, Antoinette.
Our next speaker is the Sustainability Development Leader of IKEA. She has been leading projects on clean air, raw material traceability, and digital product passport. Thank you so much for joining us, Miss Alexandra Galef.
Thank you. Happy to be here.
We also have a passionate advocate with a strong interest in working with young people. Please welcome the Youth Engagement Program Officer of Live and Learn for Environment and Community, Ms. Linh Hai Nguyen.
Good afternoon, everyone from Vietnam.
Our last guest, but certainly not the least, is a member of parliament in Indonesia. She currently sits in Commission 7, which deals with the energy research, innovation, and industry sectors. She is also secretary of the Green Economy Caucus at the Indonesian parliament. I am pleased to welcome the Honorable Dia Roro Esti Widya Putri.
Thank you so much, Antoinette. It's really nice to be joining everyone today.
Thank you so much. It is truly my honor to be moderating this session. I would first like to start with Ms. Bulgantuya. Ms. Bulgantuya, we'd like to ask you really quickly, what examples of clean air solutions have been implemented in Mongolia and how these can help improve the health of children and vulnerable groups?
Thank you so much. Mongolia is quite unique within the Asian countries. We're one of the coldest countries in Asia. We have very short summers, very cold, very severe winters, which reach over minus 40 degrees Celsius. The majority of the winter can be overcome by burning raw coal, which is the case for almost about 70% of the population. And within that, of course, children is the most vulnerable, and this causes a number of issues in unborn children and also in the young children as well. We have implemented a number of projects. Actually, we have been budgeting against air pollution from 2008, and our international community has been supporting our effort as well. But we have realized that we actually needed a national program on this. Otherwise, it would be a wasted effort. And over time, from 2008 to 2016, actually, the air pollution has increased. And there was even funneling of money that has been committed towards reducing air pollution. In 2016, the Parliament has approved the national program on reducing air and environmental pollution from 2017 to 2025. It is a comprehensive strategy which integrates policies aimed at reducing air and also environmental pollution with concrete implementation actions. We have started to take some very drastic actions. From 2016, we have started zero night tariff for free electricity for households in GER districts, which burn coal throughout the winter months. We also distributed face masks to vulnerable households. There is also distribution of air purifiers for kindergartens, schools, and hospitals, subsidies for parent carers during period of sickness of their child to avoid overcrowding of hospital facilities. This was introduced for the winter of 2016-17. Pneumococcal vaccines for children was also piloted in 2016, and since then we have expanded to cover all newborn children born in the capital city's 6 central districts. We have also banned raw coal as per 1st of May 2019, supporting briquettes production in the capital city. This has had an immense impact in reducing air pollution in the capital city where half the population reside. We also supported engineering infrastructure, what we call service centers, where heating, also wastewater management, etc. facilities are located which provide such services in the vicinity. There's also the suspension of civil registration of rural to urban migrants, and we also have started a program to support rural population, especially during hazardous winters, where we see majority of the households in the rural families, they lose their livelihood of cattle, and there's a huge migration into the city. The local level clean air solutions also have been implemented by local governments with the technical assistance and financial support of UNICEF. Clean air action plan in one of the provinces, Bayanghongor, has been aimed to reduce the impact of air pollution on maternal and child health. And as a result, respiratory diseases decreased, indoor air quality improved among households. The experiences from Bayanghongor has also been implemented in Gobi and Gobi Alta provinces and taken the effort. The local governments have been also budgeting for this as well, for about almost $500,000 US, both of the three provinces, and this has had an immense impact on reducing air pollution. For us, the air pollution is quite specific. Throughout the winter, we become one of the highest, polluted countries in the world. And with a small population, throughout the summer, the condition improves significantly. And throughout the winters, we have the PM 2.5 pollution levels rise to about 687 micrograms per cubic meter, which is about 27 times the level of World Health Organization recommended as safe. So the majority of the efforts that we have been taking has been to decrease the coal burning stoves in the GARE districts, and also, most importantly, also supporting infrastructure and also renewable energy infrastructure as well.
Thank you so much, Ms. Bulgantuya. We'd like to turn over right now to Ms. Soma Dota. We'd like to ask, what in your view are the challenges that need to be overcome in developing sustainable solutions for women and children in reducing specifically indoor pollution? And also, what solutions exist to address indoor air pollution? And in other words as well, what has worked? Ms. Soma?
Thank you very much, and greetings to everyone. So let me take a moment to introduce myself and my organization. So I represent Energia, which is an international network working on issues of gender and sustainable energy. And we have a presence and we have partners in 36 countries, 36 partners actually in 18 countries. So let me begin by saying that the magnitude of the problem, I think, is pretty well known now. And like Manjeet said, the decimal points don't really matter. The good thing is that the technical solutions for indoor air pollution are mostly available now. And these are basically what is called blend: biogas, liquefied petroleum gas, LPG, electricity, and natural gas. So these technical solutions are available, which are clean, they meet WHO standards, and they are pretty good. However, there are several issues of business models, there are issues of affordability, especially in areas which are geographies which are difficult to reach, and these are these are also the areas where biomass is available, and hence a motivation for people to shift to a more expensive fuel is relatively less. So that is one issue. Like I said, business models, affordability is one issue. The second issue or challenge is actually what is very ingrained in most of our societies, which is a very clear demarcation between who's the primary user within the household and who's paying for the technology. Basically, the intra-household dynamics. So in most cases, women's decision-making and position within the household determines whether and how much can be spent on on modernizing let's say the cooking energy system. And oftentimes within the household, this is not just prioritized enough. It's just not important enough. This is, of course, also linked to affordability, that in poor households, there are so many urgent, absolutely important expenditures to be made in terms of food, clothing, children's education, health, all of that, that this, gets a backseat. So this is an important, very important thing. In fact, a recent study in India showed that more than 2/3 of the LPG using households are actually, it's a man who decides when to order. So the control over a device that you're using for most women is not really there. That's the second issue. To some extent, and really, I think a limited extent, there's also an issue of behavioral change. And this again is, of course, linked to mainly to affordability and cost of refills. Like I said, it's difficult to expect behavioral change when you're going to find difficult in terms of affordability to refill. And the final challenge I'd like to highlight is that it is only in the last 5 to 7 years maximum that clean cooking is getting the kind of importance it deserves, which is a pity, actually, because given that it's actually killing more people than tuberculosis, why is it not a public health issue? And that is a major, major issue. And as a result of that, the investments that are made in the sector really fall behind as compared to electricity, but also as compared to what the level of investment is required in the clean cooking sector. For achieving universal energy access, we actually need almost $150 billion annually. And the present level of investment is only 11. So there are only a handful of countries that have a very distinct policy on clean cooking. And finally, I'd just like to highlight one challenge, which is that in most countries, there's no single pen holder, of cooking energy as a sector. So it sort of falls between ministries. In most countries, improved cook stove falls under forestry or environment ministries. LPG is in petroleum, electric cooking is in power sector. So definitely a holistic picture and a holistic strategy is lacking in most cases. So in my view, those are some of the challenges that you asked about.
Thank you so much, Ms. Soma. We'd like to go back to you in just a bit for a couple more questions. But right now that you've mentioned a few investments, a few pathways forward, we'd like to turn it over to get the perspective of the private sector from Ms. Alexandra Galef of IKEA.
Thanks so much for having me here for the discussion today.
Thank you. We're curious to ask if you could introduce IKEA's affordable solutions for clean air at home. But more than that, the inspiration behind this, the why, and of course, the very significant action plan forward. How can we actively engage the private sector to support implementation of clean air solutions, such as what you are doing? And of course, what obstacles do you think hinder the private sector from contributing in the fight to beat air pollution? Ms. Galef?
Thanks very much for those quite critical questions. People know IKEA as a home furnishing retailer, so perhaps it comes as a surprise of, what does a furniture company have to do with air pollution? But for us at IKEA, we want to have a positive impact on people on planet, and that means inspiring and enabling people to live a healthier life at home. So of course, when we think about a healthier life at home, clean air jumps out to us as a big priority. We know that 9 out of 10 people worldwide are not breathing clean air, and it's not really right that clean air should be a luxury just for the few. We've heard as well from the other speakers that children and women are disproportionately affected, and we want to make sure that the home is a healthy and safe place for families and for individuals. So in our sustainability strategy, we've committed to contributing to a world of clean air, and we do that in 2 main ways. So the first is connected to actively reducing air pollutants from our value chain, reducing our impact. And the second is connected to enabling people to purify the air in their homes, some of those solutions that were mentioned. But I'll just touch briefly on that first point about actively reducing the air pollutants from our value chain. There we see a lot of possibility to integrate our actions on air pollution with our actions on climate change. So striving towards electrification, 100% renewable energy in the value chain, and of course, continually improving efficiency in materials and manufacturing and in our transport that can make positive impacts on both climate and clean air. We also are exploring more, innovative ways to reduce air pollution. So for example, with our Better Air Now initiative in Northern India that we launched in 2018, where we are using some of those agricultural wastes that are normally open burned, that some others have spoken about. So in this case, rice straw waste to make products actually. So we launched a collection called Forendring last year using that rice straw waste to make baskets and lampshades to prevent it from being open burned. And then in a few months as well, we'll have the next iteration of that collection, finding different ways to use that valuable material. But of course, that's just one example. What we really want is to take this holistic approach across the value chain. And there we've seen a big gap because there is no methodology or guidance for the private sector to get that emissions inventory in place. So we started working with the Climate and Clean Air Coalition and Stockholm Environment Institute to set up that methodology and guidance. And actually coming soon in COP26, we'll launch a first iteration of that to enable the private sector to calculate our baseline impact and then to make those data-driven decisions on how to prioritize reductions. If I switch then to the second commitment that I mentioned, enabling people to purify the air in their home, this is really where we come in with our IKEA product range, developing those affordable and accessible, efficient solutions in the home. We have a range of air purifiers that recently came out. We're particularly proud of our Stark Finned air purifier that actually can be integrated into a table. So for those of us that live in very small spaces, it's important that we have innovative ways to integrate these clean air technologies into our homes. And lastly, we have a really big focus on raising awareness, as many of the other speakers have mentioned. It's really important that people understand this issue, and that's where we can use our expertise in life at home to help people understand the affordable and easy, often free solutions at home to reducing air pollution. Things as simple as using an exhaust hood while cooking, opening your windows to ventilate when the outdoor air pollution is low, keeping the mold and humidity down by using, an exhaust hood in the bathrooms, making smart choices about which cleaning chemicals we're using. So really finding ways to use our role as an expert in life at home to help raise that awareness. But of course, we can only do this all together. Governments, academia, the private sector, we really need to join hands to tackle this quite significant issue. Thank you.
Thank you so much for sharing all those insights and, of course, the inspiring and hopeful pathways forward that IKEA is taking to allow consumers to make more mindful and sustainable choices that are accessible and inclusive. Thank you so much. And from Alexandra, we'd like to turn it over to the youth really quickly to Miss Lin Hai Nguyen. We'd like to ask Miss Lin, could you share the recent activities in Vietnam where the youth was involved in air quality improvement and what opportunities exist to strengthen youth engagement in clean air efforts?
Thank you, Antoinette. To answer your questions, I would say that young people have been really important stakeholders in air quality improvements in Vietnam. And I'm glad to have the chance to share that here with you all today. So firstly, I think that the young populations in Vietnam has been contributing the most to the awareness raising activity. And to be a little bit more specific, they take quizzes or e-learning courses to attain basic knowledge on the topic. And then as individuals or youth group, they update and spread related information, so news through running social media campaigns or organizing events. And another group of young people that I want to mention here is the teachers at school. They have been integrating air-related topics into lessons or extracurricular activity at the school. And they also come up with really creative initiatives, such as hanging AQI flags to let students know when it's safe enough to play outside, or together with the students, they develop educational products in form of comic books. And secondly, besides raising awareness, the young people also take specific actions. Some of the examples that I want to mention is that the youth have been doing to improve air quality in Vietnam is planting tree, making playground for urban children, or other initiatives using sustainable energies. And they also practicing the green living lifestyle, in which you take small action daily to reduce waste or better the living atmospheres around you. And they also strongly promoting and spreading it to their own families and community. And besides, as a result of the courage to promote citizen science, technical products like low-cost sensor to monitor IQ in Vietnam are actually produced by young adults, in fact. And recently, we also see a really positive sign that the young researchers from university have been conducting a number of air-related research, and among them, the health impacts of air pollution on the group like the elders or children. It's a really favorite topic. And before move on to the next questions, I want to wrap it up a little bit here that In early 2018, when I joined Live and Learn to work for the Clean Air Green City projects, climate change or plastic waste were, more familiar topics for young people. But now seeing such awareness and many actions from young people like this in this topic, I think it's the result of collective efforts and actions from many different stakeholders. And about your questions about the opportunities that exist to strengthen youth engagement in clean air efforts. Firstly, I want to mention that the public concerns on air quality have been increasing in recent years in Vietnam. And a way that we at Live Learn often use to illustrate it is that if you search the keywords ô nhiễm không khí, which in Vietnamese mean air pollution on Google back in 2018, then there would be just about 400,000 results. However, if you do the same thing, and I actually tried yesterday, then the numbers of results is now more than 25 million. And additionally, I also want to mention that last year, our friends MHC Vietnam and Save the Children also have launched the Young Voice report, which surveys almost 2,000 Vietnamese children aged from 11 to 16. And one of the main findings of that survey is that among all other environmental issues, soil, water, and air pollution are the problems that children worry about the most. And I think that what I have been sharing is both the result and also the motivations for the fact that there is more information about air quality to access here in Vietnam nowadays. To be more specific, in recent years, before there's little information and sharings on air monitoring in Vietnam. However, our countries have been able to develop a networks of air sensors across the countries, especially in the last 3 years. Youth school, particularly in Hanoi and Ho Chi Minh City, have a lot of access to low-cost air sensors. Besides, there also more educational material, there's more communication products and research on the issue. And I myself also have the chance to work with and see really active participations of news agencies and televisions in spreading air-related message to the public. And one really amazing example that I want to add here is that the national televisions of Vietnam has been including air quality news in the daily weather forecast program. As a result of these two opportunities, I think that, and it actually happened that there comes more chance created for young people in terms of funding, in terms of networking, or capacity development from development agencies, NGO, businesses, schools, and so on. And just to add one more point, I think that children will be benefited from the upcoming policy related to air pollution in Vietnam, such as the regulations to protect children's health from air pollution that our Ministries of Health is developing, or the Green School program, in which air is one of the main things that will be implemented in 30 schools in Hanoi from this school semester. And before to sum up a little bit, I think that this opportunity when how to say that it will somehow wakes the sense of responsibility for the future and strengthen the engagements of more and more young people. And the opportunities will also provide them with the necessary skill and knowledge that they need to take action and maybe to do their future green jobs as well. Thank you. So that's my answer.
Thank you so much, Ms. Lin Hai-Wen, for sharing the perspective of the youth. Truly inspiring, hopeful, and powerful. And we are running out of time in this session. We'd like to speed it up just a bit and turn over right now to, of course, from the youth. We would like to hear from the Honorable Roro, who is also one of the youngest members of Parliament in Indonesia. We would like to ask Honorable Roro, why is it important for you to address air pollution and its impacts to children? And could you briefly speak about Indonesia's policy and plans on air pollution, how it fits within the national low carbon development or climate resilience strategy?
Right. Thank you so much for that question. And thank you for having me here today. It really is an honor. And I'm very happy to have heard so many different perspectives with regards to this topic. So firstly, why is it important to address this issue? I think it's important because of the significant impact it has on the health of either children or people in general, and also how it has the potential of impacting human capital or the quality of human capital of a particular country. We recognize that this may ultimately create a multiplier effect. So when people are unhealthy, this will impact overall productivity of a particular country, and it will further hinder economic activity and thus also hindering economic growth. And I'd like to kind of share a little bit of statistics that I managed to kind of read about. So the first coming from the Air Quality Life Index, saying that, the average global citizen is really exposed to particular pollution concentrations of over 3 times the WHO's guideline of 10 microgram per meter cubic. So this is something that we are currently facing right now. And also, secondly, 82% of the global population live in areas where the particulate matter is smaller than 2.5 micrometers, or PM 2.5, as we all know as well. And so this has the potential also, when we talk about pollution, it has the potential to reduce global average life expectancy by 2.2 years. So there is a significant impact when we speak of, air pollution and the consequences that it has on health. I also read up on some statistics from UNICEF, and maybe in a more localized context of Indonesia, air pollution is actually among the top 3 health risk factors for child mortality. And so the effects of air pollution on children, particularly on children's health, is very, very significant here in Indonesia. There are 2 reasons. The first being that, until the age of 12, our lungs, or the children's lungs, are not fully developed as yet. And also the second factor being that most children, spend a lot of time outdoors in comparison to adults. And so this may also have an impact on their health. The more that they are inhaling negative or polluted air, this will of course affect their health in general. And when we talk about polluted air, we're talking about the air full of combustion of fossil fuels, right? From whether it be coming from industries or energy sources, or also transportation. And this is really important. And when we talk about the policy, as you mentioned earlier, as well as being one of the questions, I'd like to share that on a national context, Indonesia has ratified the Paris Agreement. So we have ratified the Paris Agreement, and we also have what's called the nationally determined contribution with the goal of decreasing greenhouse gas emissions by 29% and 41% with international aid. And this has been enforced by law number 16, year 2016. So we have some kind of a progress with regards to this. And also something that I'd like to share is that 30% of Indonesia's carbon emissions come from the energy sector, and 50%, roughly 50%, comes from the land use change, and forestry sectors. And so recognizing that this is the situation that we are currently dealt with, we have a target of achieving 23% renewables by 2025. And with that being said, because right now we're still at 13%, there's a lot that needs to be done. And given my role right now in Mission 11, overseeing the energy, research, innovation, and industry sectors, we're currently pushing and proposing a bill on renewable energy with the hopes that we can meet target faster, right? And so this is something that we're currently pushing. We're currently working alongside the government as well, particularly the Ministry of Energy in our country. And lastly, we also there are a couple of other existing legislations, but I'd like to also stress on this last one, which is the Presidential Regulation number 18, year 2020, which talks about really just the National Midterm Development Plan between the years 2020 to 2024. And this is known as the low carbon development initiative or plan of Indonesia. And it has within the LCD, within the energy sector particularly, it involves 3 core programs. So there's one on renewable energy, which is something that we're trying to push right now. There's also one on energy efficiency and also fuel oil substitution. So I think what I'd like to kind of share as well, given my work now in Parliament, is trying to really just push energy transition in our country. This is not as easy as it looks, because the fossil fuel industry is still dominating the energy space, and it has created multiple, an extensive multiplier effect when it comes to job creation. But what I'd like to stress in this occasion, and this is something that is ongoing with the government, is trying to kind of open everyone's eyes that, when we push for energy transition, this will create greener jobs, and thus will contribute in creating a more sustainable future for our country. I'd like to end by reminding everybody that this is a multi-sectoral problem, which requires a multi-discipline solution. So at the very essence of, we have in Indonesia what's called gotong royong. So gotong royong means collectively working together side by side in achieving a particular target. And what I'd like to kind of share with everyone here is to make sure that we understand where our role is, and to be open in joining hands and working together. And with the hopes that, with doing this together, we can have an optimal solution. The government has a role to play, legislators have a role to play, but also society, creating these movements and making this conversation becoming mainstream, and turning it into a more personal problem. This whole problem of climate change and air pollution is a very personal problem. And I feel like this is very much, it's not discussed enough, in my opinion, particularly with the current policymakers. So this is something that I'm trying to also discuss with my friends here in Parliament, with the hopes that this will push us in further fighting for the right solutions and pushing the right policies forward.
Thank you so much, the Honorable Dia Roro Esti Widya Putri. We really wish that we could extend this session, such wonderful conversations, truly meaningful, important, and urgent, that need to be discussed. We are truly grateful to each of our wonderful panelists for sharing their experiences, their insights on clean air solutions that are human rights-based and successfully employ gender perspectives and child-centered approaches. Now, it is clear from today's discussions that we all have a role to play. There are solutions available, and it is up to us to scale them up to ensure that no one gets left behind. We hope that you've been inspired to serve as champions to help improve air quality in your own communities. A big thanks to our panelists once again. Thank you very, very much for joining us. We truly wish we had more time. And thank you so much to our session partners, UNEP Empower Project, UNICEF, East Asia Pacific Regional Office, Office of the United Nations High Commissioner for Human Rights and Vital Strategies, and to you for helping make this a meaningful conversation. Do keep an eye out for cleanairweek.org, where we will be posting our content for you to watch it on demand. My name is Antoinette Toss, and it has been my pleasure serving as your host and moderator for this session at the Third Asia Pacific Clean Air Partnership Joint Forum. Stay online and please do join us for the final session of the day, The Future of Sustainable Transport, Electric Mobility, and Digitalization to Address Air Pollution, which will be starting in just a few minutes. See you there.